Good morning. I'd like to start off with a few numbers. 80, 400, 1600, 22,567. I'll explain shortly. Hi, my name is Arshan Soria, and I'm an intern with University Health. As a hospital system, University Health emphasizes its philosophy of care, extending beyond just medical treatment, but also the holistic well-being of each patient. One aspect includes nutrition. The One World Food Pantry at University Health Truman Medical Center offers patients coming through their doors access to nutrient-dense food products. This is where I spent my time at. At the pantry, we currently average 80 patients daily, which would also be 400 patients per week, Monday through Friday, and 1,600 patients a month. Since the start of the pantry back in August of 2022, we've helped serve 22,567 households. But what's next? How can we expand our reach to our pantry services to more people within the Kansas City area? So during my internship, I helped conduct and read through intakes, noting where the people were traveling from. So we noticed that we receive a lot of patients who live in close proximity to the hospital, but we also see many patients coming from all around the Kansas City metro area in farther places. For these people, we noticed that the only times that they would come visit the pantry was when it coincided with appointments at Truman Medical Center. The difficulty of traveling such a distance creates a barrier for them, which is why they would only visit during medical appointments. Another pain point we realized was also the food waste that was happening in the food pantry. So with the nature of being a food pantry, we rely on a lot of donations made by our partnering organizations. And from the day of delivery, it leaves us a very small window of time to disperse that food out to people in need. With these time constraints, perishable food items like our fresh fruits and vegetables and perishable items also start to begin to expire. And this can help, this also is difficult for us, having us to leave or having us to get rid of them if not distributed out in time. So for solving this issue, my proposal is to establish satellite food pantry stations at University Health's walk-in clinics. So University Health in Independence has two walk-in clinics, and I'd propose in establishing food pantry stations in them. They would be, once established, it would be a similar experience to what they would experience at the main pantry, where they would they would also go through a short screening process, and then after would have the option to choose a sack lunch or fresh produce bags. For the assembly of each of these food bags, they would happen every morning at the main pantry at Truman Medical Center. And then they would be shipped out every morning with the University Health transport vans to each of the satellite stations. So these satellite stations would serve as an additional distribution points on top of the main pantry to help mitigate food waste, as more food bags can be created and distributed out in a set amount of time. Their placements is also strategically located to serve patients a more convenient option without having to travel as far. So for the timeline, I would propose in a 6-week timeline. Weeks 1 and 2 would be all about purchasing the equipment for daily operation. So that includes refrigeration units, which I will explain in a little bit. Weeks 3 and 4 would include the recruitment of personnel needed to help run the pantry stations. Weeks 5 would include the creation of flyers and ads to help promote the station. And then week 6 would be the official rollout of the pantry stations. So for our budget, we'd be asking mostly for funding. So I estimated $1,400 for the establishment of each pantry location at the clinic. $1,000 would be allocated towards refrigeration units to store our refrigerated items. $250 would be allocated towards storage, like food bags, to help organize it once we're in the clinic. $150 would be allocated towards proper signage and for marketing to help promote the clinic and the services that it offers with the pantry. And then in addition, we would also need additional personnel to help run the clinic. Together, we can help take a step towards increasing accessibility for nutritious foods for all in our one world. Thank you.